So the gills of the lamprey are located here inside the brachial pouch. There's 7 slits here, and then they lead outside. There's 7 slits out here as well. And a better picture is kind of hard to see on the lamprey, but here is where they would be located, and this is what they would look like. There is a velum that's located on the anterior of the gills that shuts off, that closes off the gills from the digestive tube as the lamprey is feeding, so that way blood doesn't flow into the gills while feeding. While feeding, the water will passively flow over the gills, so that way when the velum is shut, like the blood doesn't flow into the to the gills to damage them. And while lampreys are not feeding, the water will flow through the esophagus into the gills more normally. So lampreys also have a dorsal fin and a caudal fin along the tail, and they do not have any pectoral fins or pelvic fins. They only exhibit these two.
Alright, so we're going to be discussing the digestive tract of the lamprey. Up here we can see we have the mouth. It's going to be more of a suction cup structure. It's going to latch on to its victim or to its host, and through these teeth that it has on this cup, it's going to create a very large wound where it can siphon the blood out of the wound. It also has these sort of mouth glands that secrete this anticoagulant right around here to prevent the blood from clotting. Now, through the mouth, through the esophagus, it's going to go down past the gills, dumped by the liver, this part right here. There is no gallbladder, by the way. It's lost in metamorphosis. It's going to dump bile into the esophagus. It's going to break down any sorts of fat that it may have eaten. It's going to bend down into the intestine where it's digested and absorbed, follow all the way down to the cloaca where it is promptly excreted.
So the lamprey's heart is a little different. It has 2 chambers. What will happen is blood flow will come oxygenated in the gills and then deoxygenated to the heart. This little small chamber right here is the atrium. This one is going to be the ventricle in the lamprey. For the blood flow, it'll specifically go to the atrium, which is that little bitty part there, into the ventricle, which is the big muscular part there, and then out through this part of the ventricle to the gills. Then it gets circulated into the body. Deoxygenated blood comes back to the atrium, to the ventricle again, and then out to the gills again. The top part is going to be the atrium, and this big muscular part is going to be the ventricle. In lamprey, sexes are separate. This is known as dioecious. Because the genitalia ducts are absent, the gametes in both sexes are discharged into the cavity. So we have a male lamprey right here. It's hard to tell since it is sliced this way and not this way. There is a cavity here, and what they'll do is that these little gametes will exit through the genitalia pores and into the freshwater environment. They do external fertilization by releasing these gametes through the genitalia pores and out into the water. Lampreys are oviparous, meaning they lay their eggs when they reproduce. These eggs are sticky and range from 0.8 to 1.3 millimeters with a yellow tint to it.
Alright, so here we're going to have the kidney. It's going to lead out into the cloaca, runs along with the artery. It's going to pick up and filter the blood, take out any sort of nitrogenous waste, and it's going to flush it out the cloaca via ammonia, typically. Now, this is going to help the blood acclimate to any sort of outside conditions, because it also excretes ammonia through the gills as well. All right, so today we're looking at a model of the brain of the lamprey. Okay, so up here, we've got the cerebrum up here, along with the olfactory bulbs in these sort of lighter yellow. It's very large because most of its senses rely on smell. All right, in the back behind that, we have the midbrain in blue. And this very back part here is going to be the cerebellum, which leads into the spinal cord. And below that is going to be the medulla oblongata, which is this nice little pink cream color. All right. So still on the nervous system, we can see on the very top, we have a little bit of what appears to be an eye at the very top. And at the very front, we see a lot of nerve endings are going to be found at the very tip of the nose. This is where a lot of the olfactory receptors are going to be to help it navigate using smell. You can see a bit of the brain here, and it follows through atop the notochord. You see there's a little cavity. We can see the spinal cord right there. It's going to be very light.